Amazing. Thank you so much, Ayad, for the amazing introduction. It's lovely to see so many of you have joined the call today for our talk, and we are truly honored and humbled with this kind of reception. Thank you to everyone, especially Ayad and his team, in helping set this up, and we look forward to bringing you the presentation. Before starting this presentation, I think I'd like to introduce my team who's on call and presenting with me today. So, Awais is our events officer for the GI Society. Then we have Sana, who's our phase one coordinator. Then we have Hannah Bashir, who's our phase two coordinator. And then we also have Bilal Ali, who is the vice president. I myself am the president of the society, and some other members which are in the call and may also answer your questions include Jeevan Landa, who's our chief of social media, and then we have Hamza Junaid, who's our well-being officer, and then we have Jabir, who's our treasurer, and then we have Joshua Thomas, who's our secretary. So I think we're ready to start. So if we can get the slides on, please. I believe the slides are on now. So if anyone has a problem with seeing the slides, please do let us know in the chat so we can fix that for you. Apologies, Hannah Bashir, she's having some connection issues. So as soon as she's ready to go, we'll start the presentation. Thank you.
Hello, how about now?
Amazing. Yeah.
Perfect. Okay. Sorry about that, guys. Assalamu alaikum, everybody. My name is Hannah, as I've been introduced so kindly by my colleague Adam. So I'm going to start off the presentation. So I'm going to start off by discussing our medical school student life, some of the projects we're doing, research and beyond, which is the title of our presentation. So I'll be discussing introduction, tips, and student life. Next slide, please. So this is a photo of the George Davies Centre. So for us in Leicester, this is the main home of Leicester Medical School. The building officially opened in 2016, so coming up to nearly 10 years ago now. At the time, it was recognised as one of the most sustainable university buildings in the UK, which we're really proud of. For us as med students, the GDC or the George Davies Centre is where the majority of our medical school journey takes place. So we attend lectures here, we sit our exams, we meet our personal tutors, we get involved in different student societies and activities. So it's a place where you'll find different teaching spaces, computer labs, and study areas all under one roof. So we're really, really fortunate, alhamdulillah, to have a place like that. Next slide, please. So this is the map of the UK, which is probably nothing compared to Egypt, but what we've highlighted in the red box is Leicester. So that's the city in which we live. although we live there for uni, we're not all from Leicester. So I myself am a little bit south. I don't know if you can see Birmingham on that map, but it's just below Leicester. I know that a lot of my colleagues are from London or up north or different areas of the UK, but we all study together in Leicester. It's a really vibrant and welcoming place. It's a city, a very student orientated city because there are two very large universities there. So you've got the University of Leicester and another university. So there's a strong student atmosphere there. It's also a really multicultural city. There are lots and lots of Muslims there, which is obviously lovely. Lots of beautiful mosques. Again, nothing that's going to compare to the architecture in Egypt, but beautiful in our eyes nonetheless. Next slide, if you can, please. So, moving on to something that's probably a bit more useful for you guys and a bit more content, the preclinical years, so years 1 and 2. So, in our 5 year course of medicine, it's split up into the preclinical years and the clinical years. The preclinical years being years 1 and 2, where we learn a lot of physiology and anatomy before we're then introduced to the hospital environment in years 3, 4, and 5. One of the biggest challenges in medical school is actually just managing the sheer amount of content we learn. So, what's really, really important is staying organized. So, for me, using timetables and planners really helps keep track of lectures and placements and deadlines. Whether it be digital or a physical one that you're using, they're really, really helpful. Another thing is also breaking down the large modules into smaller chunks. So in our second year, in our first and second year of university, we learn about cardiovascular physiology, which I'm sure you guys have already done. And for me, that felt like such an unmanageable topic. But when you break it down into smaller chunks like cardiac output or ECGs, learning each thing individually feels a lot more manageable for me personally. And I'm sure that a lot of my colleagues will agree with me there. Another thing that's been really important for me is something called active recall. So, active recall is the process of learning things spaced out. So, let's say on a Monday I learn something and then I revisit it a few days later. So, a combination of active recall and spaced repetition are the methods I use to make sure that I'm able to learn my content properly. Lastly, I'd just like to say understanding things is really, really useful. So, I think it's easy as medical students to just want to rote learn, but actually understanding the physiology and understanding the mechanisms that we're learning about is really, really helpful to make sure that we have proper retention rather than just remembering it for the exam, then forgetting it. Again, so for me, I don't know, everyone's got their different styles of learning, which is something that's really important to acknowledge. So, how I learn might not be how you guys learn, and how I learn might not be how my friends learn, but finding what works for you is really, 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 really important. So, for me, like a lot of other med students, flashcards are really useful. So, apps such as Anki or Quizlet have been a real game changer. Using those combined with what I've mentioned above, like spaced repetition and active recall, has really, really helped me learn my medical knowledge. So, and the last thing I want to talk about on this side is maximizing anatomy. So, I find anatomy really, really hard to learn. I'm sure lots of you guys in this chat will agree with me that I just find it really tedious and really difficult to learn. And even going into 5th year, my anatomy knowledge is probably not as good as it should be. But if you try and maximize your sessions, so your dissection sessions, using models and 3D resources, that's really, really helpful. Um, Personally, for me, I think going into your sessions prepared rather than going in and not knowing anything means that when you actually are in the session, whether it be a dissection or a lecture, having some knowledge prior means that when you're actually in the session, you're able to understand what's going on rather than trying to learn it for the first time. Next slide, please. A little bit more about the preclinical years, so years 1 and 2. I found that sticking to a routine rather than cramming really helps. I agree that that's easier said than done, and at risk of sounding like a hypocrite, because I know that in years 1 and 2, I was someone that probably revised a bit too close to exams, but I feel like that's just something that every med student has to go through. But sticking to a routine rather than cramming really does help. So trying to do a little bit every day and build strong habits so that you're reducing your stress when you do get to exams. Balance is also key, so I make sure to have time for societies and hobbies, which helps make me feel better in myself. So please make sure that you're not just doing medicine and that you're spending lots of time with your family or friends or doing whatever it is that makes you happy too. Seeking help early is also invaluable, whether it be a tutor, peers, or older students. Getting advice before problems build up saves you a lot of time and stress. Networking is also important. So for me, getting involved and just talking to other doctors or other people in my position, like we're doing on this conference call now, is really, really helpful. Finally, formative assessments are really good for checking process and reflecting on mistakes. Using them actively has helped me adopt my learning strategies. So using our mock exams and sorry, I just saw my camera go off. Was that, can everyone still hear me?
Yes, we can hear you, Hannah.
Okay, perfect. Sorry, I think it was just from my end. Slide 5. Okay, so moving on to our clinical studies, so years 3, 4, and 5. So learning on placement really comes down to being confident and proactive. So at first, for me, I wasn't very confident doing clinical tasks, so taking bloods, putting in cannulas, and
I'm sorry, but sorry, Hannah, but your voice is not very clear.
hold on, let me try again. How's that?
Yeah, much better.
Is that better? Okay, perfect. So I'll start that side again. Apologies, everyone. So learning on placement really comes down to being confident and proactive. So what you put into placement is what you get out of placement. At first, I wasn't someone that was super confident on doing practical tasks like cannulas and bloods, and I was really, really hesitant to ask. But with time, if you keep practicing whenever you can, volunteering to take histories from patients, taking bloods, and assisting in theatres, with time you'll become much, much more comfortable. It's really amazing how quickly your confidence can grow when you do repeated practice. I also try to make sure to practice my history taking and examinations, trying to do this in line with how you do for your OSCE examinations. So in the UK, we have something called an OSCE exam, which is basically our practical exam at the end of the year, where they test us on how we talk to patients, basically. So if you try to do this throughout the year in real life practice, it becomes a lot easier. I'm someone that follows the observe, do, and reflect approach. So, watching seniors or those that are experts and really skilled at doing this, reflecting on their techniques, and thinking about what they've done that I can add into my own practice. It's also really important to make sure that you connect your preclinical knowledge to what you see on placement. This is something that's been really useful too. Understanding physiology and pharmacology makes seeing the symptoms and treatments much easier. And finally, what's also important is learning from your mistakes. It's inevitable that in years 1 to 5, you'll make lots of mistakes, and that's normal as a medical student. But every error you make, as long as you learn from them, has helped me become a lot more confident and a lot more professional in my clinical practice. And I really, really hope to build on that in years to come, inshallah. Next slide, please. So for my final part of the presentation, I just want to talk a little bit about making the most of the clinical studies years, so year 3, 4, and 5. So to make the most of placement, what's really important is ensuring that you integrate with the team. Again, I know that this is really, really easier said than done. It's difficult, especially when you're a med student. Again, I'm not sure what it's like in Egypt, but here in the UK, it's a little bit awkward to walk into a room full of really experienced doctors and tell them that you're a medical student because you're kind of the lowest of the chain, if that makes sense. And it's a little bit embarrassing and a bit awkward. But try and introduce yourself and let people know that you're really keen to learn. It really helps you get involved and be a part of the workflow. Again, touching on what I said earlier, it's really what you put in is what you get out. So if you're someone that's gone in and you're showing that you're really enthusiastic and really keen to learn, the doctors there are going to be more than willing to put their time into you. OSCE preparation or whatever exam it is that you guys do in terms of speaking is also another big part. So try and practice early with your peers or your students. So for us in the UK, we have our clinical partners that we're assigned. You may have something similar in Egypt, but practicing with those people that you're with, using university materials is really important. Try and focus on your communication and empathy and the exam structure to make you feel more confident during your assessments. Time management is also really key. So balance your ward time with revision and rest. So like I said earlier, try and make sure that you're not just doing medicine. I'm sure to every single person in this chat, there's a lot more to us than being a medical student. So make sure that you're giving yourself time to focus on those hobbies. Finally, make use of all the resources available. There's lots of resources out there for medical students, alhamdulillah. So just to finish on the fact that you're not alone in this. If I'm just speaking about my colleagues here, but majority of them in the call have really been there when we've been through some difficult times revising, and they've always been willing to share their resources with me. And alhamdulillah, I've always been grateful for that, because if it wasn't for them sharing their resources with me, I definitely would not have made it to my final year of medical school. So try and use each other, revise with each other, and inshallah, you guys will fly through it with ease. And with that, I'll move on to the next part, which I think Awais is going to start with.
Well, yeah, before that though, thanks first of all for your presentation. It was pretty good. But I do have a couple of questions for you if you don't mind.
Yeah, of course.
Yeah, so this isn't going to take a lot of time. It's just a couple of questions. So first of all, you mentioned spaced repetitions and flashcards and like
Actually,
Anki and stuff.
there's some sort of an echo in your voice right now. All of us actually.
Yeah.
I believe someone has opened their mic. If it's possible for people to check, or I would mute everyone and then unmute the rest who's talking. That would probably fix it. Or it's actually gone. Can you guys hear me? All right, I believe Amori can go on now.
Okay, is that good?
Perfect.
All right, so I was saying that you obviously mentioned trying spaced repetition and flashcards and stuff like that, like Anki. So obviously we at Medbank have had some experience with that, but we've heard from people who've tried it that doesn't really help them or hasn't made as much of a difference as it should have. So if there's anything that you can really specify about how you can maximize the benefits that you can get out of these things for the people who have had problems with it.
Yeah, thank you for your question. I think what's important to acknowledge is that everyone learns in a different way. So if you're finding that Anki or flashcard apps aren't useful for you, then it might just be that you need to find another way of learning. That being said, there are different ways to use Anki. So for me, I find it really difficult to use flashcard apps on my own. So I'm someone that loses attention quite quickly. So if I'm sat on my own in my room studying using Anki, I find that I lose focus quite quickly and I'm not getting much benefit out of it. But if I'm sat with my friends and we're all doing the Anki together and we're all learning the flashcard content and testing each other, I find that to be a much more beneficial way of learning. So it's not an individual sport, medicine. Anki doesn't have to be something that you do individually either. So it doesn't need to be so. You can do it together, and that is absolutely fine as well. Also with Anki, Anki isn't something that you can cram. So it's not, if your exam is in 1 month, for example, it's very difficult to cover a large amount of content on Anki quite quickly. So Anki is something you do need to start quite early and be quite disciplined with it, because the way the algorithm works is that it is based on spaced repetition and active recall. So if you start it early, you'll end up seeing the cards lots and lots of times to ensure that you're learning the content. So if you're someone that's trying to learn a lot of content in a short amount of time, Anki isn't something that I would use at all. I hope
Yeah,
that answered the
thanks.
question.
Yeah, it was pretty good. So yeah, just sharing or studying with a group of people really does help. And yeah, just this having this interactive way of studying sure does make a difference. So that's that. Next question is obviously anatomy is overwhelming and it is my least favorite subject right now, but how can you can like not exactly memorize it and still do well? Like, how can you kind of understand it more than just memorizing it for an easier way to then do well at the exams and recall the information that you get from it?
Yeah. So I resonate with this quite a lot because, again, like I mentioned in my portion of the presentation, I really struggle with anatomy, and even years down the line in medical school, um, I'm not someone that's very good at it. But what has worked for me is trying to put anatomy in a clinical context. So rather than sitting and trying to learn all the different structures in the shoulder, in the arm, or whatever it may be, trying to learn the conditions that I need to know about in terms of the shoulder and the arm, and learning the relevant anatomy. So the anatomy that's gone wrong in that instance, for example. So, for example, for certain types of wrist fractures, instead of sitting and learning the different types of bones, etc., because I'd struggle with that, learning each different condition and knowing what's affected and what problem that causes for the patient. So trying to make it more of an applied anatomy rather than sitting and just learning the content. And again, seeing the condition in real life really helps. So for us, we have orthopedic wards and orthopedic clinics, and actually going and sitting in those clinics has helped me reinforce my knowledge a bit more rather than learning about it on a screen. So for me, going into placement and seeing those conditions in real life, but also putting the anatomy within a clinical context, so it makes more sense for me.
Yeah, perfect. Also, you mentioned clinical wards and stuff like that, but obviously the transition from preclinical years to clinical years can be a little bit of a challenge for some people. So how have you found that transition for you, and what advice can you maybe give for the people who are just about to do that transition? And yeah, just what advice would have you wanted to have heard from the people who have had this transition before you that you might want to pass on now?
Yeah, so great question. Um, I think you only really understand the transition once you've done it. But for me, and I think a lot of my colleagues will agree with it, is it's a really great transition. The first 2 years of medical school are, you don't really feel like a medical student. You feel like you're just learning so much knowledge, but you can't really put it into practice. But actually going in to years 3, 4, and 5, you're able to put all of that knowledge into a clinical context. So, if anything, I think years 3, 4, and 5 for me personally felt a lot easier than years 1 and 2. It felt a lot more natural. But in terms of making the most of that transition and trying to make it easier for yourself, I think speak to your older years in terms of medical school and see what helped them. Also, get into contact with your placement coordinators or your clinical tutors, so doctors on the wards you're on, quite early, and ask them where you'll be able to find the best experience. I think going into year 3, especially, you're not really too sure on where to find the best experience in terms of the hospital, but getting in touch with your placement coordinators or tutors enables you to do that. And also, there's no reason why you need to like be on the ward all day every day if you're not learning something. The times I've learnt the best within the hospital are the times where I've gone round to different wards and tried to pick up skills in different places rather than staying in one ward and just learning one thing. So, as scary as the transition sounds, I think for the majority of people, it's a lot easier. The only difficulty with it really is that in years 1 and 2, especially with our curriculum in the UK, we're very spoon fed in the sense that our lectures are all laid out for us, the content is all laid out for us, and it's very clear what we need to learn. Whereas in years 3, 4, and 5, you kind of have to figure it out for yourself. So if you try and get into a good routine early on with speaking to your seniors, speaking to your placement advisors, trying to understand what you need to learn early on in year 3, you should be in good stead, inshallah, to enjoy your last 3 years of medical school.
Yeah, sounds good. Sounds good. Um, well, I think, yeah, I think it has been great from you, Hannah, and I'm very glad to have been the speaker or the modulator asking you these questions, because you have conveyed great answers. And yeah, if next speaker or presenter is ready, make sure to start.
Yeah, thank you very much. As Hannah has introduced me, my name's Awais. I am the events officer for the GI Society, and I'll be presenting my section on advice for studies and examinations as well. Can I get next slide, please? So, like I mentioned, I'll be talking a bit about examinations. Examinations in Leicester, the way they're structured for us is that we have SBAs and you also have some MCQs, so SBAs and we have some SAQs as well. So that's short answer questions and multiple choice questions. So I thought I'd start off by going through just about the SBAs first. I think my number one tip when it comes to SBAs, and I think a lot of my colleagues would agree with that, is try to use question banks as much as possible. There's some more popular ones in the UK, such as QuestMed and Past Medicine, where they allow you to sort of apply your knowledge and apply your knowledge and use past papers and get familiar with the question style and the common scenarios that you may face in your actual examination. And what I find is this sort of deliberate practice helps us build that confidence and also identify those areas that we can focus on. I think one of the biggest things with these sort of websites is the notes they give you after you get the question wrong. I find that for myself, when I'm going through questions, I can get quite a few wrong and I might not know where I'm going wrong. And because I like to understand what or why I'm getting it wrong, I think the notes for these sort of websites are very helpful. The next tip for me would be to cover the whole curriculum. Now, obviously, as we all know, medicine has so much to cover, and there's a lot of topics that we need to get through. And it may be tempting to skip on that specialty where, there's only a few marks in the examination itself. But what I find is as long as you focus on the high yield topics, for example, for especially such as ophthalmology, it may only have a couple of questions in the actual examination. But what I found is if I focus on the high yield topics like glaucoma or even macular degeneration, you can pick up those extra marks that can help bring up your grade and ensure that you're able to get over the mark and pass your examinations. So overall, I'd say make sure you cover the full breadth of the curriculum. It's just so that you don't get caught off guard by any of the topics during the examination. My next tip would be to understand the SBA structure. So the SBA structure. So each sort of SBA has three parts to it. It has the STEM, often with the clinical details, the lead-in, and then often the answer options. I would say it's very important that you read them carefully in order. Sometimes it's tempting if you see a couple buzzwords to skip straight to the answer options. And I know from experience that has costed me time, especially in exams as well. So it's very important that you sort of go through the entire STEM, the question itself, and the answer options in order, and then try to pick the best one from the answer options. I think the biggest thing to realize when it comes to SBAs is that at times all the answer options may be correct, but often one is the best one, and that's the one you need to make sure that you're able to differentiate from the others. My next tip would be about the cover test. So the next thing would be about the cover technique is about cover test. So what this essentially is when I have an SBA question, what I would do is I'll cover the answer options. So instead of looking at it, and this prevents me from looking at the answer options prior to answering the question. And so what I do is it allows me to sort of guess the answer and helps me focus on the scenario more itself rather than get distracted by the answer options. My fifth tip would be to make sure that you go with your gut for certain questions. Now we all know there's certain questions in the exam where we're not really sure what the answer may be. It may be a 50-50. But what I find is if you go with your first instinct is often correct, you want to make sure that you don't overthink those questions and trust your initial answer, unless, of course, you have a clear reason to change it. The next tip would be about managing your time well when you're doing your examinations. I think it's tempting when you come across a question that's a bit more difficult to spend a lot of time thinking about it. But what you need to know is that all the questions are marked the same. So if you're stuck between two options for a question, it's important that you pick one and move on, and then save those more complex questions for later. Again, remember that they're all worth the same, so it's important that you manage your time effectively. The last one is a no-brainer. It's about making sure that you attempt all the questions. Never leave a question blank, because at least for our exams in the UK and in Leicester, we don't get penalised if you guess something wrong. So even if you're unsure, just make sure that you take an educated guess, because you never know, you might get it right. And I know that from my experience, I've definitely had some of those. Can I get next slide, please? Next slide. Can you guys see the next slide? Okay. Okay, so my next tips are surrounding the SAQs, or short answer questions. So in Leicester, one of the more difficult things that I find with our exams compared to other universities are these short answer questions. So essentially what they are is this quite similar to the SBAs, but you don't have those multiple choice options. And for these questions, there's a slightly different way you should approach them. The most important thing when it comes to this is that you should make sure that you read that command word carefully. For example, list, /name, describe, explain, outline. Now, each of these words have a specific sort of explanation. For example, list or name means that you should provide some short bullet point answers. Describe is more about asking for features or characteristics and may involve you putting in a few sentences. Explain is about providing reasoning or cause and effect. Outline is more about giving the main points, but not going into too much detail. And the thing with these sort of questions is if you ignore the command word, you risk giving the wrong type of answer and eventually losing some marks as well. The next thing is don't overwrite. When it comes to these SAQs, it's often tempting to just verbally sort of vomit everything you know. Often that's how you sort of learnt it. But SAQs, remember, they are not essays. Examiners usually want concise answers. Often they want a few words or maybe even a sentence per point. And often writing too much can waste your time. And this can also include irrelevant information that probably won't earn you any extra marks. So make sure that you focus on clarity and precision. The next thing is the use of AI. Now I'll talk a bit about AI later as well, but for now we'll talk about AI in terms of your examination practice. So I know me and definitely some of my friends, we use ChatGPT a lot, especially when we're struggling with some specific topics that are a bit difficult to understand. But you can also use ChatGPT and other AI tools to make practice questions for you. So often what you can do is you can give these AI tools a prompt and then subsequently generate some questions on the topics that you may be struggling on. And what I find this helps with is that it allows you to give targeted practice on areas where I'm a bit weaker on, and it just helps me to get used to the style of the SAQ, so I'm a bit more confident when it comes to the main exams. Finally, I'm touch on just flashcards and spaced repetition. I know my colleague Hannah touched a bit on using flashcards such as Anki, but I just thought I'd just elaborate a bit more on that and also bring in a concept that they incorporate. Now, active recall, as Hannah mentioned, is a very key strategy. Tools like Anki or even Quizlet can help you make flashcards for definitions or important lab values, indications for certain drugs, or even key facts that you may want to use. And this is where this forgetting curve comes in. Now I've put the forgetting curve on the right here in the image, and from what we know about the forgetting curve is that research shows us that if we forget information rapidly, it shows us that we can forget information quite rapidly if we don't review it, often about a day or two after we learn it initially, and then this period will increase the more we review it as we go along. So by spacing out our reviews and going on material just before you sort of forget it, you'll retain it a lot more effectively over time. Okay. My next part is about AI and specifically the use of AI in medical research. Now, me and some of my colleagues have utilized a AI tool called Consensus AI. So you may be wondering, what is it? So essentially, it's an AI-powered search engine. Specifically, it's designed for scientific research. And the difference between this and other standard search engines is that if you give it a question, it won't just give you a list of links. It can understand the question that you give it in the language that you put it in and provide a summarized answer based on the scientific literature. Now, for example, you could type in, can aspirin combined with dipyridamole reduce the risk of stroke, as is in the example here. And what it does is that it scans multiple peer-reviewed studies, it synthesizes those findings, and then it tells you what the consensus on that study is. I feel one of the more standout features is the consensus meter. And what this essentially tells you is it gives you a visual representation of how many studies either support your question, either don't support it, or are maybes. Now, I feel like this is particularly helpful for scientific research, and because not all studies obviously agree with your question. So having that consensus meter helps you quickly judge the strength of the evidence that you have. The other important thing is to understand that Consensus AI is it's designed for both students and researchers. So it's honestly amazing for whether you're doing a literature review, if you're writing a paper, or if you just want to explore some academic questions, because it can just help you save a lot of time. A bit more about Consensus AI. is that once you sort of search the question, you'll get this summary, and each of those points are linked directly to the original study. So what this allows you to do is easily being able to check the source, and I feel like it's quite helpful again for the assignments or when you want to verify any evidence. Again, I've got an example here that you can sort of touch on, and it's about the anti-platelet regimes that are used in secondary stroke prevention. Again, instead of reading dozens of papers individually, what Consensus AI, you can use Consensus AI and immediately see where most studies agree. So you can see how the different claims, there's certain key claims here and the strength of the evidence for them. There's also some reasoning and link to the papers as well. So it's extremely helpful, I felt, for my research and some of my other colleagues as well. The last part that I want to emphasize is that Consensus AI is actually currently free for students for 1 year. And honestly, it's just great for universities or doing any academic work without needing any institutional access. Yeah, and so that sort of concludes my section about examination techniques. And hopefully, if you utilize these tips, inshallah, they should help you with your exams.
Yeah, thank you, Dr. Awais. It was a very great presentation from you as well. And yeah, I also do have a couple of questions for you, if you don't mind.
Yeah, sure.
So obviously, when you mentioned SBAs, you mentioned going with your gut, but obviously, um, as we have all tried that before, and it didn't really end up in a in a in a great way. So, how do you think is a good way to train that gut feeling in the best way possible, so that when you go with it, it is more likely than not to land on a correct answer?
Okay, of course, that's a very reasonable question. I think the one thing probably I didn't mention too much on is it honestly comes with practice. So if you're utilizing these questions quite regularly and you're going over them quite regularly as well, often what happens is you sort of build up a bank of knowledge in your mind about different conditions, different differentiating features, and other key sort of information that can help you differentiate between either the key management strategies, the key investigations, or even being able to differentiate between different conditions. And what we know with sort of memory is obviously when you're sort of learning everything, it gets stored in your sort of brain, but sometimes certain information might be difficult to sort of recall immediately in the moment. I feel like from what I've noticed, the more I've sort of practiced and utilized these questions and I figured out where I went wrong, in the exam when I've come across these questions where I may be a bit unsure, I feel like what tends to happen is with those sort of questions that I feel like there's a slight familiarity, but I may not be entirely sure. And in that instinct, I might go with, as I mentioned, my gut feeling or my first instinct. I feel like it's often being correct rather than not correct. And I feel like this is something I've sort of trained myself over the years in med school. I feel like perhaps during my first and second years, it wasn't as effective, but as I started to use more question banks and really hone into that practice, I feel like your sort of gut instinct gets a bit better, and often what you pick initially, or what you may pick as your first answer option, will more times often be right rather than wrong. Yeah.
Yeah, makes sense. Makes sense. So it just comes with practice and, you know, solving as much questions as you can, so that you're more familiar with the correct answer, so that you can, so that your gut feeling points towards it. Next question for me is, when it comes to SAQs, obviously, as you have mentioned, it is very tempting to overwrite or just, you know, say everything that you know, but is there a specific or a balance that you can that you know that you can have, so that you do not write more than you should, or answer just, you know, for the question itself, and not for anything else other than that, so that you doesn't affect your marks or that you lose any of them?
Okay. So when it comes to SAQs, one of the tips that we've sort of learned from our university or from my own practice is that SAQs often get assigned marks, and the marks sort of reflect the number of points the the question expects of you. So, for example, if there's a question that was a 4-mark question and it told me to explain a disease process or a condition or maybe in the management, then they would be expecting me to provide them with 4 points and 4 points only. Some of the other key things is that the way typically where examiners read questions, they tend to read the questions from the first thing that you put, and then they read it in sort of, from left to right and then up and down. So what's key here is that you want to put the answer options or the answers that you feel like are the strongest initially, and then leave some of the other ones that you may have towards the end. I find another helpful sort of thing is to sort of flag any of the questions where you may be a bit struggling on, and to make sure that you come back to them later on as well. I think again, it comes back to also reading the command words as well. If you read the question and perhaps even highlight any of those key words, it allows you to be able to provide the exact information examiners may be looking for, rather than sort of provide information that they may not be looking for. So I think what's key here is really just to read that question again twice if you're a bit unsure. And when you're providing the points, make sure you sort of write your strongest points first, and then the rest sort of later on, because often that's how they sort of mark it. Yeah, so that's how I would say you would answer those SAQ questions.
Yeah, thank you. Last question is, obviously you mentioned AI. Well, how exactly can you use AI enough, but not become really dependent on it or using it in a wrong way? Because obviously using it for stuff that like SAQs, for example, can lead to unreliable or misleading answers, and stuff that would end up being counterproductive rather than just being as helpful as you would hope they would. So how do you, or what's your guide on using AI for you personally?
Yeah, of course. With AI, it is one of those sort of tools where it learns based on what you sort of feed it. And the other thing is one sort of important lesson that I've learned when it comes to using AI for producing questions is you really need to provide it some source material as well. So what I found extremely helpful is our medical school gives us some example questions, and what I do is I'll use those as a source material or example. I will then put a very specific prompt prior to giving it the question or feeding it that question, something along the lines of, can you please produce an SAQ question? And I'll say on the topic of, and then I would put the source material and say, base it on this source material, or keep it as similar to this format as possible. Now, what I found is over the years of using AI in this way, I've been able to produce questions that are quite reliable and quite similar to the sort of structure that my university requires. Similarly, I feel if you have those sort of source materials, it can be very, very helpful to sort of feed that into the AI system, and so that it can provide you with questions that are more tailored towards both your curriculum and also your medical school as well.
Yeah, thank you, Dr. Owais. That was all. And that's all for me as well, Ammar. And from now on, my fellow modulator, Dr. Mariam, is going to be the one helping or aiding in conveying our next questions for the next presenters. So thank you.
Sure. Thank you very much, Simon.
Hello, this is Mariam Ibrahim, one of the modulator for this program. So excited being here with you, and I can see forward that we're gonna do perfect initiatives and meaningful changes. So if we have to hit the ground running and start with our segment right now, I think it's the medical school projects with Dr. Sana. So if she's ready, I'm waiting for her.
Assalamu alaikum, Mariam. Thank you so much for the introduction. Is my audio okay?
Okay.
Lovely. Okay, so I will get started. So assalamu alaikum to everybody in the meeting, and I hope it's been really useful so far. I will be discussing a little bit about the extracurricular projects that you can get involved with during your medical school, and I will also share a little bit of my experience as well. So next slide, please. So why should you get involved in projects during your med school? Well, first of all, it's really good for engaging in projects because it can be really, really rewarding. And also, it can help you build transferable skills. So this includes critical thinking, data interpretation, teamwork, and academic writing as well. It will also help strengthen your portfolio. So most specialty applications, especially academic and surgical or highly competitive roles in the future, they always value evidence of research or quality improvement. So getting ahead of the game of this early on in your medical school career would be a really useful thing for you to do. Also, it helps enhance your understanding of medicine. So research deepens your knowledge of how evidence guides clinical practice and standards. And then also it's really, really good for networking. So many collaborations begin through research or audit projects. So you can build rapport with clinicians, and this can be really beneficial for you again down the line. Also, projects help you explore your interests. So you can test your enthusiasm for certain specialties before your clinical placements even start. So it's a really good way to get ahead of the game. So a few of the different projects that you can get involved with include audits, QIPs, which are quality improvement projects, literature reviews, etc. And Bilal will discuss this a little bit later as well. So next slide, please. So what is an audit? How do you do it? And what are the different challenges? So an audit measures current clinical practice against an agreed standard. So for example, in the UK, we have NICE guidelines. And the goal is to identify gaps and suggest improvements so we are better compliant with the guidelines. So here on the left is an example of an audit that I completed during my third year clinical placement in general practice, which then I presented to the partnership team in the practice. Then using this work, I was able to produce this poster that you can see, which I was then able to present at a conference held by my own university, which I gladly won a prize for. So I was able to really gain something out of it. So how do you complete an audit? So first of all, you need to contact your supervisor or mentor. If you don't have one yet, it's really important to just be confident and speak to anyone who might have a project that you're interested in. So, you can email them, you can go to their clinic and then have a chat with them, see what projects they might have going on and see if there's anything available for you to get involved with. Ideally, you want to choose something that is achievable and relevant, so you really need that guidance for that reason. Next, you want to identify the standards, so using your national guidelines. So like I mentioned here, we have NICE. I'm not sure what it is in Egypt, but I believe you do have the Ministry of Health and Population guidelines, so that could be a good start. And then afterwards, what you would do is collect data. So this would be from a sample population of patients. This can be retrospective, it can be prospective, and you'd use patient records for this. And then you would go ahead and compare results. So you want to see how the current practice aligns with the standard that is set out by the national institutions. And then you'd go ahead and present these findings. So like I did with my partnership, with the partnership team in my general practice, you would discuss this with your supervisor and department, suggest improvements of how, and also how changes can be implemented to improve the practice. Therefore, you're making your audit useful to not only you in terms of research, but also the organization that you've done the audit with. And finally, it's really good, if possible, if you can re-audit as well. So this is to make sure that the changes that you've highlighted and identified have actually improved the practice. Now, saying this is easy, but there are challenges when it comes to audits as well. So for example, accessing patient data, especially when you're not in a clinical setting as a preclinical student, can be hard. That's why it's really important to get in touch with a supervisor and mentor and build that relationship and rapport with them so you can have access to things such as patient records. Work with your supervisor early on so you can use them down the line as well and really get the most out of that relationship. Audits can also be time consuming and, alongside your studies, you might not have a lot of time. So it's really important to manage your time effectively. Now, luckily for us, we were provided the opportunity to submit an audit during our third year GP placement, but this might not be the case for you, so you have to be really proactive about it if it is something that you're interested in. Especially if you have limited experience. So it's really good to, again, use that mentorship and use the guidance from your supervisor. Next slide, please. Now, like I mentioned, it's really important to make these projects worthwhile because this is super curricular activities. It's not necessarily mandatory for you, especially as a medical student, but it will help you later down the line. So after every audit that you do, or every quality improvement project that you do, you want to produce it into a poster or a presentation, which you can then, go ahead and present at a conference, or which can be national, international, or just local. And again, this will provide evidence for you later down the line that you have had research experience. So, as I mentioned before, audit isn't the be-all and the end-all. So there's quality improvement projects as well. This is basically a way to improve patient care or service delivery using a structured change methodology. This is usually a PDSA cycle, which stands for Plan, Do, Study, Act. So the steps to complete a QIP includes essentially identifying an area that requires improvement, similar to an audit. For example, it has to be something that's practical and measurable, so like hand hygiene compliance. And then you'd have to define the aims and the measures. So what do you want to change and how will you measure the success of the hand hygiene compliance, for example? And then you would plan the intervention. So it has to be something achievable, but will bring about change as well. And then you carry out the change and then you evaluate it. So you measure the results and you compare it to the baseline. And finally, you act on this. So you modify the approach and you repeat the cycle if possible to see if your modified approach has a better impact on the change. And then finally, again, you want to present and share your outcomes. So this can be locally or at national conferences or anything like that. Another thing that you can possibly do is a case report. Now, case reports can be completed during your clinical shadowing or summer placements. Again, this is probably better and more targeted towards students in clinical years. And essentially, these are detailed reports of interesting case or a unique case, which can document unusual findings, innovative ideas, or adverse events. So similarly to a quality improvement project, and audits, it helps you refine your research skills in that you're doing an academic write-up in this as well. And in terms of identifying a case, it has to be something that's a little bit different, a little bit unique, and not something that you typically find in the literature. And it should usually describe a unique learning point as well. Make sure you always obtain consent from the patient and organisation as well before you do a case report, which is really important. And then finally, make sure again you use your findings to do a good write-up and submit it to perhaps a local student-friendly journal. So again, you can gain something out of it. Again, there are different challenges. It can be difficult to gain access to cases, but again, you have to get in touch with a clinical supervisor or attach yourself to a team to try and get these opportunities, if that makes sense. And then another thing that you can do, but is particularly time consuming. So honestly, it's up to you if you want to, throw yourself into this, but systematic reviews and literature reviews, these are solid pieces of research which can help get you a publication or, again, a presentation. But again, Bilal will talk a little bit more about this, so I won't delve into this too much. But next slide, please. So my final advice really is, I feel like we don't really get taught too much about taking up projects in medical school, but you do have to be really proactive about it. So if you want to do something, just start small, even if it's a short audit or a single case report, and just make it worthwhile. So try and present it, try and make a poster, try and get a certificate in some way or form. to show that you have research evidence. Always find a good supervisor and build a rapport, because at the end of the day, their mentorship and guidance will make a huge difference for you. Make sure you document everything, so you'll need it for your CV and to build your portfolio later down the line. And collaborate. It's a great way to network, join your peers or student research networks. You don't have to do it alone, do it in a team. And it is ultimately really rewarding. And finally, I think make sure you're patient, because generally research and projects can be slow. They can take a lot of time and a lot of effort. But like I said, if you plan achievable goals, then it can be incredibly rewarding. Thank you.
Thank you so much for your meaningful information. That was really so valuable for us. So if you don't mind, if I can ask you questions right now.
Absolutely, please.
Okay, as you mentioned first, that is so valuable if we can develop the critical thinking beside the development, like researchers projects. So if you can tell me, how can we develop this skill?
So beside research projects, how we can build critical thinking skills?
Yes.
Is that the question? Yes, of course. So I think this can be difficult in preclinical years, because you're sort of, for us anyway, we're sort of spoon-fed the information, as Hannah mentioned earlier. But I think when it comes to clinical years, developing these critical thinking skills will be attending the clinics that you're assigned to, and then being proactive and asking the doctor to see whether you can see patients yourself, for example, and then maybe have the doctor observe you and then prove to them that, you know, you can take a good history, you can think for yourself, and that you can provide a differential diagnosis and your potential management plan. And in that way, you're thinking critically and you're thinking for yourself without, you know, just observing the doctor or observing different teams. You're actually doing it by yourself, and you're taking that step and being proactive, if that makes sense.
Okay, thank you so much. So the next question is, how is the main difference between an audit, the quality improvement project, and which one of them is the most practical for and helpful for the students?
Yeah, absolutely. So an audit basically evaluates how current practice guidelines compare to established guidelines or standards, but a quality improvement project is a little bit less specific, and it focuses on improving clinical practice using a structured intervention, if that makes sense. So whilst a clinical audit can include an intervention as well, it's more at looking at observing where the gaps are, if that makes sense. I would argue that both are, you know, equally as beneficial, but I believe an audit is a little bit more accessible for students because generally there's a lot going on and there's a lot needing to be done in terms of audit, because different patient samples are constantly monitored, whereas a quality improvement project can take a little bit more time because you have to implement that change and then make sure that the change has had an effect as well. I hope that helps answer your question.
Thank you so much. That was so helpful. So the next speaker is here. Go ahead.
Thank you.
Assalamu alaikum everyone, my name is Bilal. I'm going to be heading up the next bit of the talk on research, conferences, prizes and publications. I hope you enjoyed the seminar thus far. I'm going to be hoping to talk about the following, and I hope by the end of the talk you'll be a bit more informed about the different types of research and hopefully what you can do as a medical student and what your research, where your research can take you. So we'll get started now. So over here, I've got this slide on the hierarchy of evidence, but before we go into this, I just want to preface it with this introduction. So at a medical school, you learn so much information of the time that you're there. And truthfully, by the time that you actually graduate, a lot of the stuff that you may have learned, unfortunately, will be revised and in fact, often proven wrong. And to paint the picture of this, if you imagine back in the 1950s, the time it would have taken for all of the medical knowledge known at the time to double would have been 50 years. But now, in the present day, the time it would take for the same achievement to happen would just be 73 days. That highlights the incredible rate of progress in modern medicine, and it highlights the challenges of why when we graduate, inshallah, when we're on the wards and applying our medical knowledge, the need to evaluate research and incorporate it into our clinical practice. So what does that mean for the rest of us? That means that our goal isn't to memorize everything, because if things are changing all the time, that's going to be impractical and virtually impossible. So we need to get used to developing those skills to critically appraise scientific research and being able to apply it effectively to our practice. So in simple terms, we need to evaluate the research we read. We need to identify, is this helpful for our patients? Is this reliable and trustworthy? And can we integrate it effectively in our practice so we can help out our patients? So with this slide now, I want you guys to take a look on the right-hand side. Here we have not scientific evidence, so things that we shouldn't take as granted and use in our clinical practice. So personal anecdotes, someone online claiming that so-and-so treatment is useful. These are gut feelings, and they've just given some examples of other websites. On the left-hand side, we have this diagram. It's a quite famous diagram, and some of you guys, if you've done population studies, may have seen this before. It's known as the hierarchy of scientific evidence. And inshallah, we're going to talk about each step little by little, going from weakest to strongest. We use the research in this pyramid to help inform our clinical decisions when we're practicing. So if we start at the bottom, we have case reports, opinion papers, and letters. Sana covered a lot on case reports, so we'll just skip that one. But with opinion papers and letters, this is often where a experienced healthcare professional, often a doctor that's been graduated for a while, or a consultant that's been practicing for a very long time, shares their individual experiences or their expert viewpoint, particularly because that's an important area of their practice or practice that they do very commonly. And they'll submit this to like a journal, or they'll give their opinion in a newspaper or at a conference, for example. And as Sana mentioned, case reports are a very good entry point for producing research as a medical student, and I highly recommend it. Often you can talk about rare and interesting diseases in these cases. So if you see something that isn't that common, you could perhaps work under a senior doctor and produce a case report. It helps to highlight more information on the condition, and also helps to add to the evidence base on that condition if there isn't much about it. So we take a step up now to animal trials and in vitro studies. These are experiments that we do on animals and living tissues outside of their normal habitat. We do these often in a lab, and as a medical student, it can be quite difficult to get this type of research. That's in the UK at least, and often a lot of these labs, they aren't partnered with the university. So if you want to get involved in this type of research, you may have to utilize your network or search on LinkedIn and essentially network with these individuals involved in this research and get involved. With the findings of this research, we call it often preliminary. What that basically means is that they're early findings. They give an initial idea about what's possible with the research and what the research is showing. And in terms of a real life example, we often use this in the pharmaceutical industry, not ourselves, but our colleagues that make medicines. And they often test new medications on animals and living tissue. They want to see if it's safe and effective, and if the dose is okay, before they move on to human trials. Taking another step up now on the cross-sectional studies, this is definitely a type of research that I would recommend medical students to do. So it's a type of research that provides a snapshot of the population at a given period of time. So an example is a survey calculating how many people over the age of 60 have, say, stage 4 lung cancer in Leicester. It helps to identify if there are any particular trends or anomalies in a population, but this type of research has its drawbacks because they aren't often detailed enough to prove cause and effect. And hopefully when we go in the higher levels of the pyramid, those types of research will more likely have evidence proving cause and effect. And as I said, these are ones that I would highly recommend you to do, but I would like to preface that with most research, it's very difficult to do it on your own and without guidance. So a good practical idea is to contact individuals in your medical school. If there's a public health society, that would be a good start. And if you don't have one, you can get in touch with faculty members that have an interest in public health. And even if that's a bit difficult, your public health authority, because they're likely going to be doing this anyway as part of their job. So got a lot more to talk about, so I'll try speed through this bit, but give enough detail. So case control studies, we are comparing people with a condition. These are the cases to those without them. These are the controls. An example is comparing people with lung cancer to those without. We're going to find out if certain risk factors like smoking are more common in the cases. And this is going to help identify possible causes and risk factors. Next up, we have cohort studies, and we have prospective. This is following a group of people over time to see if they develop a condition, versus retrospective, looking back in time, assessing whether such risk factors have contributed to the group that we're studying, and seeing if those risk factors have resulted in the individual developing the disease that we are interested in. Like with some other types of research, as I mentioned earlier, cohort studies take a long time to complete, and often you're at medical school for a good period of time. However, often it may not be a long enough time to adequately do some of these cohort studies, particularly those looking into the future. Next, we have randomized control trials, and these are a very good type of research. So often we see these in double-blind drug trials. I'm going to talk a bit more on that side of things. So what we do is we randomly assign people to different treatments or interventions. One group's assigned to a new intervention, and the other group is either assigned to an existing intervention or a placebo treatment. So, for example, if we had a already known medication, we're going to see if the new medication on the market is better, worse, or just the same. Our existing treatments going to be compared against a new one. And in order to make sure that the results are fair and have a minimal kind of chance that the results are due to bias or due to chance, we do something called double blinding. That means that the study participants, the ones taking the medications, are unaware of which one they're taking, and also those organizing the study are going to be unaware too. And what we aim to do is to compare the effects of each intervention to see whether one is better than the other. And as I said earlier, in practice, the most common type that is done is double-blind drug trials. So now we're at the top. We're looking at meta-analyses and systematic reviews. And these are considered some of the best evidence out there. And often what we're doing is we are looking at available evidence anyway. So what we do is we find a research question that we're interested in. We do a deep dive in all of the research that is available on that question, and we use strict criteria to find and select the studies and assess them to see if they meet our criteria. And what we do is we hope to provide a clear and unbiased overview of the evidence and see whether the evidence is pointing in the same direction. A meta-analysis takes a step forward. We introduce statistics to help us find out how accurate the findings are all the findings saying the same thing. And you may have seen something called a forest plot, and often with it's the one with the diamonds, and if it's in the center, that's a good thing. And that is a visual way of representing meta-analyses. So with meta-analyses and systematic reviews, you can definitely get involved in these as a medical student, but they can be quite timely, given the amount of papers and research that you need to read over for your inclusion criteria. But it's important to know that this can be of significant value to the medical world. Yeah, so my final point before we move on to the next slide is that just kind of a reality check, really. So it's important to think about where you are in your careers right now. And at this point, being involved in any research is quite a big achievement. You don't need to do something as amazing as a meta-analysis or systematic review at this stage, or even aim to do it during medical school or make it as your minimum. There's so many different types of research in this pyramid that you can get involved in. And ultimately, you need to do that first one before you move on to different types of research. And with the arduous nature of medical school, you've got so much going on that often it can be very difficult to find the time to do research, and it's totally okay. As a medical student, doing research is a bonus, but when you get more senior in your training, when you become like a registrar or consultant, the shift's going to be from bonus all the way to almost an expected standard. And the final point is that if you are looking for research opportunities, unfortunately, they won't fall in your lap. You're going to have to actively seek out these opportunities. You're going to have to ask around, maybe connect with people on LinkedIn and reach out that way, or speak to your supervisors and help find those opportunities for yourself. Okay, so I'm going to move on to the next section now. So saying that has been of interest to you, we're going to talk about choosing the right research question. So there are a few pointers that I've put here that can be quite useful. So you should always start with your interests. Think about something that you have a personal kind of experience with, or something that you've learned that's really interested you. That can be a good gateway into thinking about a research question. Often the best research questions come from a genuine interest. And I have an interesting fact to tell you guys. When I heard it as well, it kind of made sense, but it also made me quite surprised as well. They say that the younger you are when you get involved in research, often the more ambitious your questions are and the more groundbreaking your research is. I heard this on a podcast called the Human Lab Podcast. There's a very famous neurobiologist on there, and he speaks to world-renowned researchers. Next, it'd be very good to speak to doctors and researchers and nurses about your research idea. Scratch what I said about researchers. You want to see what they think about it, and you want to see if they believe it can fit into the clinical context. If it doesn't fit into the clinical context, that could be the sign that maybe you need to speak to more of the academic researchers. And you want to see if your problem actually needs research on it as well. And I'm going to move on to that just now. So you need to identify gaps in knowledge. Say you have an amazing idea, you need to see if research has already been done on it. Because if you do research on it and it's already been kind of covered, then unfortunately it's a waste of your time. And there's a specific type of review that you can do for this. It's called a gap analysis. So essentially you're reading around research that you're interested in, you're checking what has been already explored in this area and what hasn't. Other things are checking guidelines, seeing what guidelines are lacking clarity. So when doctors, nurses are looking at guidelines and they're just unsure, scratching their heads and not knowing what to do, that could be a sign to do a literature review, find out what is already kind of what these guidelines are based on, see what is missing, and perhaps that could give you some ideas on what to do the research on. Next, observe clinical practice. If you keep seeing some issues that are coming up in clinical practice, I think these are some good points to consider when doing your research and something you could bring to a mentor. Finally, and ultimately, I want you guys to brainstorm. So don't self-censor yourself. So if you think of an idea and you think it's a silly one, I think you should still write it down regardless, because ultimately you guys are starting on your research journey and your points may be quite useful, but they may be really ambitious. And it's really good to see that process change over the period of time when you kind of understand what you need to do for research. So I think you should always write down what you're thinking and you need to make sure that you stay ambitious and generate as many possibilities for yourself. Finally, start small. I think this is a really important one because you're a medical student at the end of the day. You need to pass your exams. You need to become a doctor first before you can do anything else. If you do ambitious projects, they can get often quite overwhelming, and you want to see through your projects and get something out of them. I'd say it's more reasonable to put yourself forward for shorter projects and complete a couple of those and broaden your skill set rather than just doing a big project which could eventually just fall through, because that's the reality of research. Sometimes you may spend a lot of effort doing research and often you may not get something out of it. You may not kind of present it at a conference, it may not get published. Okay. So now we're going to talk about evaluating your research question. So say you've thought of a research question, now you need to see if it's structured well and if it's something that is detailed enough for you to do research on it. And here I've provided a framework, quite a well-known framework called the PICO framework. And if you use this to structure your research question, it can really help you in forming your methodology and moving a bit forward from kind of the initial stages where you're kind of just figuring out what you're going to do. So we have the bullet points: population, intervention, comparison, and outcome. So population is, who are we interested in? So is it population that we're interested in? Are we interested in individuals with a condition? We need to know that most definitely. Intervention: what is happening to these patients? Are we giving them a treatment? Are they being exposed to something? We need to know that for our investigation. Comparison: we always need to compare to see if there is some sort of change. So we need to mention about the alternative intervention or whether we're comparing to a control group. And finally, the outcome. So what are we trying to measure and how do we know that we've been successful? So on the next slide, I have an example of PICO in practice. So instead of just using a bit of a more vague question, like, is this treatment effective? We can use PICO to be a bit more specific. So here we have a revised question, and we've used PICO to provide us with more information. So for population, we put patients with type 2 diabetes. Our intervention is taking metformin. Our comparison is compared to diet and exercise alone. And finally, our outcome is reducing HbA1c levels. And below is our revised question. So in patients with type 2 diabetes, does metformin compared to diet and exercise alone result in lower HbA1c levels? Right, so I'm going to move on now to making an abstract. So an abstract is often something that you would do either in your planning stages of your research, if you're doing a kind of pre-experiment abstract, or after you've collected your research. And often we'll find that with medical research, what often happens in our colleagues' experience that have quite well published in research, they will submit an abstract after they've kind of gathered all their information. So what exactly is an abstract? So think of it as like a movie trailer for your research. Quite a interesting comparison, but if you think of a movie trailer, it gives you a short idea what the movie is about. You have an idea what the goal is, and you have a rough idea what the main results are. But it generates interest or hype for you to go and watch the movie. It's quite similar with an abstract. It's used to make people interested in reading the full study. And so that is what an abstract is. So the key things about an abstract is that this is often going to be the first part of your research that people are going to read. And unfortunately, in some cases, it may be the only part of the research that they're going to read. So it's really important for your abstract to be very clear, very concise, and for it to have all of the bits that I'm going to mention in a couple of minutes' time. So now we're going to talk about some of the contents of an abstract, and then I've got a worked example on the next slide. So initially, we need a background. We need to introduce what the clinical or research problem is that we're trying to investigate. Then we have aims. So what objective are we trying to achieve, or what is our hypothesis of our study? Next, our setting. So where are we doing this research? Are we doing it in a hospital, a clinic, or a community? And patients. So what are the patient's characteristics? How old are they? What is their gender? What condition are we talking about? Methods and interventions. So what are we actually, what intervention are we applying? And then we're going to talk about results. So what are the key findings that people need to know? Are your results statistically significant? And finally, conclusions as well. So what is the main takeaway from this research? Why does your research matter, essentially? So what are the implications for practice? And where can this research go in the future? So I hope that has made sense for you all. So now we have an example of an abstract. And I want you guys to have a very quick skim read over the abstract. So if we work top to bottom, we have an introduction, which is introducing the topic. We have our objective, which is talking about what we're trying to do. Then we have a method, so they're clearly talking about what they are trying to achieve. Then we have our results. We have our important values. And then finally, we have our conclusion. So if you guys want to take a read of that, I'll give you guys about 30 seconds, and then we'll move forward. Okay, so moving on now to conferences. So say you've done your research now, and you want to showcase your research, which you should absolutely do. You can apply to a conference. So what is a conference exactly? So a conference is essentially just a group gathering of healthcare professionals and medical students. What the goals are to share research, clinical experiences, and new developments. They can be quite fun too. I would highly recommend you guys during your time at medical school to go to some. I and myself, members on the committee, have been to a few, and they are quite good experiences. They have things such as workshops that you present research, and they discuss like advances in medicine as well. And they're really important for people to go to stay up to date with the latest evidence and best practices, because they bring some of the best people in the fields into like one kind of seminar room or one kind of location. And they're a really good place to discuss medical education. There's lectures there as well, and you have great opportunities to meet with professionals and to network. So my next points are about applying to conferences, and if you have to do a presentation, what things you should try to do. So when you're applying to conferences have specific themes in mind. So there may be like a urology conference, an emergency medicine conference, an internal medicine conference. They all have their particular niches.
If I'm not wrong, I believe there's a lot of other things that research that other conferences can do, and we'll talk about that very shortly. So it's a place for gathering of healthcare professionals such as doctors, nurses, midwives, medical students, and you can talk about your research, your clinical experiences, and new developments. They're useful for medical education and networking with professionals, particularly if you have that interest in publishing research and things. There's other things as well, such as workshops. They can be quite fun and interactive, learning about new techniques, such as like learning how to do echocardiograms and all of these quite useful things in your clinical practice. And they're very good for staying up to date with the latest evidence and best practices, but they can be quite fun to go to as a medical student as well. So now talking about how to get the most out of applying to a conference and presenting your research. So you should always try apply to research conferences that have like a relevance to your research. So make sure that your research relates to the specialty. As I said, if you've done a research project on neurosurgery, don't go applying to a cardiology conference. You need to make sure that you're aware of what the main audience is. So is it going to be quite senior doctors or like nurses and things, or is it more medical student orientated? This could change whether your work is accepted or not. You should also check what topics have been presented and research has been presented in previous years, because naturally they want to make sure that it's engaging year after year after year. And if they're presenting the same topics of research, then they're going to be less likely to accept you. Next, so we've talked about making a really good abstract. Often that is really crucial for your research gaining recognition and entering into those journals and getting accepted at conferences, so you can actually spread your research and information. And say you get accepted and you need to deliver a poster presentation or an oral presentation, I have some tips as well. So with poster design, you have to kind of think about it from the point of view of the conference organizers. They want to gather as much attention to these posters. So you want to try and make them quite visually appealing. So using quite bold colors and layouts. But make sure that you have the information on there. So make sure it's clear and concise. It's very easy to read and follow along. But I think the key thing is use less text and more images to make sure people come and see it. In terms of oral delivery, it's all about the practice. So make sure you practice your speech, your presentation. Make sure you engage with audience members. So eye contact, be very enthusiastic, and show some passion. Show the people that you care about your research. It helps individuals engage, builds a rapport with the audience as well. And finally, anticipate questions. Often the people leading the conference sit near the front and they like to ask questions to make sure you know your stuff. Okay, so next I'm going to talk about publications and prizes. So if I could have the next slide, please. Thank you. So this is another thing you can get involved in during your time at medical school. And they can be really, really rewarding. So we've talked a bit about publications, that's the research side of things, but now the prizes. So often a lot of medical schools have essays going on, essay competitions, and also the specialty websites in the UK. So they have like a Royal College system in the UK. What they do is every year they'll have like an annual essay competition, and surprisingly, they're easier to win than you'd think, because with the kind of marathon that medical school is, often people don't really apply and do these student essays. So there may be like 30 to 50 submissions in the whole of your country, for example. And so the odds are really in your favor in that case. We provided some examples here. So the Royal College of Psychiatrists have an annual competition, and also at your university, they may have some competitions. They're often created by alumnus or like alumni people that have gone to do great things. It's important to note that they can be quite challenging and they can take a lot of time. And that's kind of the whole theme of research. It can take a lot of time, but it can be quite rewarding as well. So you need to be tactical with your time and effort as well. Yep, and that's me. And so finally, I've just provided a screenshot from one of the Royal Colleges. So this is part of the Royal College of Anesthetics and the Faculty of Pain Medicine. So this is an example of a competition where you can write an essay. Here they've mentioned that it's just for individuals working in the UK, but for some of the Royal Colleges, they can accept international applications, and I'm sure there will be many organizations in Egypt itself that offer these essay prizes as well. Yeah, so next slide, please. Yeah,
Thank
so
you
that's
so much.
about me done. So thank you so much, guys.
There were so insightful points. Thank you so much. We really appreciate it. So regarding to research, I have a question for you. Do you hear me? Oh, can you hear me?
Yeah, I can hear you.
Okay, and regarding to the research, especially the types that developing or engaging with the patients. So we have a problem here in challenging treating with patients and gathering informations like the past history and also the surgeries that they have done. So they may forget like telling you the symptoms and the surgeries that they have done before. So how we can overcome this challenge? Hello, can you hear me?
Yeah, I can hear you. I'm just having to think about that question because it's a really good question and it raises a challenge that fortunately we don't have in the UK. So I may take a moment to think about that, please.
Okay.
I think often with people that have had like treatments and procedures that they're not too aware about, sometimes often they don't know the name and things, as you mentioned. Uh, what often happens in the UK is often like we'll involve the surgical team, as often they have a lot more expertise than we do. And what they can do is because they know the particular like region of where surgery has, or like a junior member of the surgical team can come, and if the individual often just talks about like what happened or where the site of the surgery is, it can be immensely helpful, particularly like if they get a consult. For example, if the doctor's working in family medicine, it can be really tough because it may have been a long time since they covered their surgical kind of material in medical school. Um, I think as well, one benefit we have in the UK is that a lot of stuff is like electronic, and even in the UK, a lot of stuff is written, and there isn't a lot of communication between different specialties, particularly from primary care, so family medicine, and the hospital. I think that's a really big challenge.
Thank you so much. That was so beneficial. So I have a question. A lot of students here asked me this question before this seminar. How can we make sure that a research project or idea is valuable enough and less likely to be rejected?
I think with that question, often it's a really good idea to speak to a more perhaps senior medical student that has published something, or to speak to one of the doctors. I think a lot of the doctors that are quite helpful with this are the doctors that are in their training post. So, like in the UK, we call a registrar, or those that have just about got into their specialty training because they're a few years ahead of us and they've had to get the research themselves. And so they'll be quite, they would have brushed up on their research skills. And so if you ask them, because they've been doing research, they'll kind of have a bit more of an awareness. Um, yeah, and I understand that as a lot of the students on this call, perhaps maybe preclinical medical students, it may be quite tough to find those kind of connections. So I think it might be good to try find a mentor in the medical school, somebody that is particularly more published. So what you can do is if you get their name, you type it into the research database. In the UK and the US, we use PubMed quite a lot, or ResearchGate. And I know that's something that a lot of clinicians abroad also use as well. If you type their name into ResearchGate, you can see how much their research they produce and if they're producing a lot. I think those clinicians are really good ones, or like faculties of the medical school that you can approach because they're always producing research. If you ask them if you ask them your research question and ask them to like appraise it, you'll get some really good advice because they're just always just focus on research, if that makes sense.
Thank you so much. So how about the best way to check that our research idea or the question has not already been done or undertaken before?
So as I mentioned in the talk, what you can do is a literature review. But before you do a literature review, you can just type in your research question into these kind of search engines for research. So the one that I can think of on the top of my head is the two are PubMed and ResearchGate. If you type in your research question, maybe make it not as precise as what you want. So say your question is really, really precise. You can initially put that question in and see how much articles there have been produced, then slowly modify your question and make it less precise and put it into the search engine and just have a read of what is already available. And that in of itself is essentially a mini literature review.
Okay, thanks so much. The last one, the students asked a lot, is the attendance to the conferences that you mentioned before, and how can we find opportunities to present our work?
Right, so very good question. So with conferences, often they'll have a lot of promotion. So they will be promoting it on like social media, on LinkedIn, on Instagram, and just they'll have websites as well. So say you have a particular medical interest, what you can literally just do is type in like a cardiology conference and then a specific area of the country that you're interested in. So Cardiology Conference Egypt 2025 or 2026, and it'll give a list of the events that are happening. Then you can just see whether it's something that is perhaps at your level. So if you see that a medical society has organized it, or it is perhaps targeted at your level by looking at the topics, you seem familiar with them. It doesn't seem like something that is kind of too like that you haven't heard of essentially. I think that's a good way of um, gauging whether the conference is for you. Also, a lot of the time when they are promoting a conference, they'll often say, like on the poster, that they are submitting abstracts. And so if you submit your abstract to the conference, then the panel of individuals that are leading the conference will read over your abstract and either accept it or reject it. If they accept it, that is essentially an invitation for you to attend the conference and present your work. Um, of course, in the UK, it is slightly more easy because a lot of student societies also um, do, and student bodies organize the conferences. But I think if you have an abstract ready for some research, no matter how big the conference, I think you should just apply anyway, because if there's a famous saying, if you don't ask, you don't get. And it's a very valuable experience just applying anyway and getting rejected because you learn so much. Maybe you didn't write your abstract as well. Maybe when you communicated with the people in the conference, you didn't articulate yourself as well as you should have. It's just all a learning experience, and I just highly recommend people give it a go.
Thank you so much. Thank you for your engagement. Okay, the another modulator will be here right now.
Right, and speaking of the last modulator, it should be Dr. Yomna. I'm not sure if she's attending the meeting or not. She's had some connection errors recently. So just give me like a minute to check on her. All right, I don't think she would be able to make any time, so we'll go with the alternative modulator this time, Dr. Omar Halawa. If you're here, I believe you're a presenter already and ready to go.
Hello. Hey Adam. I have a really good to talk to you, like a one-on-one conversation, proper conversation. We've only texted so far. So in this next segment, we're gonna talk about like beyond medical school, as you name it, like beyond the stats. I want to know some of the activities that you do, like outside of medicine. And since we're like in this conversation and we have so many Egyptian students, we want to know more about PLAB and the numerous paths that we can pursue after medical school. So please go on.
Thank you so much for the introduction. I just want to start off by thanking everyone who's on the call. You've been in the call for a while, and I genuinely hope that you've gained something from our incredible speakers. Sorry for the connection issues. And yeah, hopefully we can go on. So if you can go to the next slide, please. Amazing. So as Omar said, I'm going to be covering firstly beyond medical school. So a lot of you, from what I've heard, are freshmen. So you're hearing me say beyond medical school, and you're like, I need to get through medical school first. Don't worry, I totally understand. But it is important, to start thinking about, your plans after medical school. Speaking to some of your colleagues, I understand that some of you do want to go abroad and some of you want to stay in Egypt. And it's important to understand that if you do want to go abroad, there are certain changes you need to begin to make now and certain preparations you need to begin to do from first and second year in order to ensure that for you going abroad is easier. Now, we're going to be specifically focusing today on this call on going abroad and coming to the UK. And as the years have gone on, competition has really, really increased for specialty training within the UK. Hence, because of this, having a very good portfolio is really, really important. And I made sure that I presented this towards the end because you guys have been able to get a good grasp of what should be included in a competitive portfolio. Things such as an audit, which Sana went through, is really, really good to have on your portfolio. Research is amazing as well. But there are other things as well, apart from research and audits, which you guys can have in a good portfolio. Examples of this is getting involved in societies. Your colleagues at MedBank have created and organized an amazing seminar. And doing something like this is really, really good for your portfolio. Teaching is really, really good for your portfolio. And organizing different events is really, really good for your portfolio. Small, small things. It doesn't always have to be research and audits. Are these other things can be really, really beneficial to help make a competitive portfolio. And it's important to start taking the small steps now. I understand that you guys have a medical degree which you want to complete, you have exams which you want to pass, and the degree is at the forefront of your mind. But making small steps and getting involved into societies and trying to get into research and trying to do audits or even helping out at all and trying to begin to build your portfolio will really help you out in the future. The phrase tie the camel. You want to tie the camel, you want to make these small steps now because it will only benefit you in the future. Bilal said, if you don't ask, you don't get. You should always try ask, be proactive, go ahead and step outside your comfort zone. And when you tend to step outside your comfort zone, trust me and my colleagues could tell you ourselves, it only brings benefit in the long run. So if we could go to the next slide, please. So as Omar said, there's the PLAB exams, which I wanted to touch on. So for those medical students who want to come to the UK, once you graduate, you will begin to look at an exam called the PLAB. Okay, so it's important to know that before the PLAB, there are two things which you have to do. One is getting your degree, of course, and the second is an English exam known as the IELTS. Now, with the English exam, it's important that you pass that, and it's essential that you pass that. And once you pass that, then you can begin to sit the PLAB. Now, a tip that I have for those who are thinking about doing the PLAB is book your English exam around the same time as your first PLAB exam. This ensures that you save, a valuable couple of months. Because what people tend to do is they tend to book their English exam, then 3-4 months later book the PLAB and begin the PLAB. But the trick is just do the PLAB and the IELTS around the same time. Now, I mentioned exams. So the PLAB is separated into two types of exams. Now, the first exam is an MCQ exam. You guys might be quite familiar with MCQs, as are we, a multiple choice exam. And the length of time is 3 hours, and it will include 180 questions. Through talking with experienced doctors who are from Egypt and sat the PLAB, they were able to tell me that the pass mark varies year to year, but it's always around 65 to 70%. Now, it's an MCQ knowledge-based exam, so the best thing to do to revise for this is things that Awais was talking about at the beginning, using question banks. Now, I've attached some examples on the slides. One of the most popular ones which are used in Egypt is called Plabbable. Others are also known as Pass Test, and a good one for notes is called Samson Notes. And touching on what Hannah said as well, working in study groups and working with each other, would really help you prepare for this MCQ exam. Now, the PLAB one, fortunately, it can be taken in Egypt, and there's places in Cairo to take it. It takes place 4 times a year, so there's 4 specific dates. So if you miss one date, then you can always take the next date. Then you go on to the second part of the PLAB. So you've done your English exam, you've done your PLAB 1 exam, and now you've passed it, and you're looking towards the last part, the final stage, which is your part 2. Now, with the part 2, it's 18 stations, and it's an OSCE format. An OSCE format is where you are expected to take histories, examinations, and talk and do simulated scenarios. This is done in order to test your clinical acumen. And there are 18 stations which are done, and unfortunately, this can only take place in Manchester. So thus, if you are thinking of taking the PLAB, please do bear in mind that this will require you will be required to come to Manchester and stay the night and sit the PLAB abroad. Now that's the PLAB, okay? But when preparing, you don't to come to the UK, as I mentioned, it's very competitive. So you want to also improve your portfolio. And throughout this presentation, we've talked about ways that you can do it. Another way would be NHS experience, or just experience in general. If you have good experience, you can really reflect on that experience that you have and talk about the lessons that you've gained in your interviews. I do want to make it known to everyone in this chat who is from Egypt, there are increasing pressures on the UK government to change the legislation and laws around international medical graduates. There's a big push from UK medical students to saying to the government that they should actually prioritize medical students trained here rather than abroad. So definitely bear that in mind, especially if some of you are first and second years. In 4 years' time, it's really, really important to ensure that you guys look at what the local legislation is in the country that you're applying. Now, some of you might not want to move to the UK, some of you might want to move to the US. And so as a result, you'll have to sit the USMLE exams. That includes 2 parts, step 1 and then step 2 exams. And then another alternative route would be the MTI. Now, the MTI is for coming to the UK. But unlike the PLAB is when you come to the UK and you stay here and you practice here. The MTI is sort of different. With the MTI, you come to the UK, yes, and you train it for 1 to 2 years. After you've trained for a maximum of 2 years, you are then you then go back to the country of where you came from, and then you basically apply the lessons that you've learned in the UK and through UK medical practice, and you apply those back home and while you're practicing medicine in your home country. So those are the different routes that one can take apart from the PLAB. If you could move on, thank you. So life beyond medicine. So sometimes it's really important for us to put down the stethoscope and really enjoy life. You guys are first and second years, and as a medical student, especially when you come in, you begin to think that your life is medicine now. You just have to study, because if you don't study, you may not pass the exams. But for a year that might be sustainable, but trust me, after a year it won't be sustainable, even a couple of months. You have to have a balanced lifestyle to ensure that you don't burn out, you can carry on and you don't become demotivated. Now, I've just listed some different activities that we do outside of medicine. So, partaking in sports, watching sports, going out and eating food with each other, getting involved in different extracurricular events and societies, which is also good for your portfolios, audits, research, and conferences, and traveling. Now, our university, they organize hikes, thankfully, or they organize different events, and so we like to go to those and we like to get involved. Now, if your university in Egypt, or if there's not a strong board that organizes these hikes, if you don't have a team that does that, then why don't you become that team? If you feel like you want to do something and there's nothing set in place, this is a really valuable opportunity for yourselves to go ahead and make and organize this, okay? And that will be beneficial for your portfolio. So if there's something you're passionate about, and join a group of people that are passionate about it with you. So join a society, and guess what? If the society doesn't exist, make it yourself. It only benefits your portfolio. Audits and research we've mentioned, and conferences. One of the great questions that was asked to Bilal was about how can we get involved in conferences. I want to do a bit of a shameless plug, but hopefully towards the end of January, myself, the GI Society, along with two other societies, which includes cardiology and renal and endocrine, we will be organizing an internal medicine conference, inshallah. Okay, and through that, we will be sending a link to the people that have organized the event, Medbank. I will be sending a link to them for you guys to join the talks that will be taking place free of charge, of course, and get involved with the conference. And of course, poster presentations for you guys will be difficult as you will be abroad. However, we will be having a section where one can submit their abstracts. Bilal talked about abstracts, and when you submit your abstracts, then we'll also have prizes with that. I will send more information, so please keep your emails open and look out for it. But that's definitely a conference that I look forward to seeing a lot of you there. So if we can go on to the next slides. So I'm just going to reiterate the importance of having a life outside of medicine and balance. Medicine is a marathon. It's a 5-year journey. It's impossible to be giving 100% throughout. And it's really important to sometimes take a minute and just reflect and do things that you love to do. When you're treating a patient, you can't always look at their physical health. You have to look at their psychological health, their social needs, and you need to look at the patient as a whole in a holistic manner. At the end of the day, if you're looking at a patient in a holistic manner, you also want to look at yourself in that. Physically, we'll give the physical aspect as academics. You might be doing amazing in academia, but socially and psychologically, you may not be thriving. So it's really important to make sure that you don't only focus on academics, you also focus on your physical, social, and spiritual needs as well. As the slide says, ensure your own well-being before you tend to your patients. So if we can move on. So this is the evidence. Some of you might have been listening and going like, this guy must be lying. It's impossible to do this, but no, this is the evidence. We've had a lot of good times, all of us in medicine, as we come towards the end of our journey, and these are just some images that we've collated to show to you guys that what we say is what we practice. Thank you so much for listening, and I hope you have gained a lot from this talk and seminar.
Thank you, Adam. This was quite an insightful presentation. I'm sure that people learned so much from this. But I have some questions that my colleagues have sent me right now. Give me 1 second, please. Okay, are you ready to answer some questions?
I'm ready, man. I'm ready, of course.
First question says, what are some good ways to design a poster so it looks attractive and easy to follow?
Okay, so if we could go back to Sana's poster, please, because I think Sana's poster actually won an award. I don't know if she told you guys this. She's very humble, but she actually won an award. So the best thing would to look at something which is, has done well. So the way to make it look attractive is to make sure you synthesize and separate information which is clear. At the end of the day, um, people are going to be looking at your poster, and they'll be looking at it, and it's always the first glance which should entrap someone. If there's so much information on a page in a poster, if I see that, I'm going to be honest, I'm going to go to something that, which looks a bit more simpler. And as you can see here, that's what Sana's done. She's made sure she's put the information into small paragraphs, and she separated them with a heading. That would be the best way to go about designing your poster. Okay, making sure that you don't write too much. Okay, you synthesize and summarize information, and you make sure it's all in key points.
All right, thank you. The second question, I'm asking for myself, to be honest. I've been struggling with this. So, when it comes to engineering, people use LinkedIn. It's always linked to engineering. So this question is asking about networking. How do you network as a medical student?
Okay, that's a great question. So the first thing to do, which people forget, is the medical school you go to has so many different students from all years. That's the first step of networking. Go around your medical school. And the best way to go around and meet different people from different years in your medical school is by joining different societies and clubs. Myself, my personal experiences, I used to play cricket, so I joined the Medics Cricket Society, and I joined some other societies as well, including the MMF Society. And going to these events, you're able to network and meet people, which may even become your friends, but you also may have on a professional basis. The first most important thing is to network within your own community. And then in terms of outreaching and outside of medical school, a good way to network is by going to conferences. So Bilal, my colleague, touched on that perfectly. The way to find conferences is very simple. Just go type in your area or your region where you're from, and type in a speciality that you're passionate in, and put in conference. And eventually you'll find a good conference that's close to you that you can go to. Myself, I'm from I live in Leicester, but I went to a conference a couple months ago for neurosurgery in Birmingham, which was around an hour drive away. When you go to these conferences, you have people coming from different places, and that's also a great way to network. So you have your own university and different conferences, and then a page out of Medbank's book, to be honest with you, a good way to network is, we're on social media. This is the time, this is the generation now where everything is a lot of social media involved. If you look on Instagram or Facebook and you find something that someone's doing, for example, research or an audit, people typically post it, just message them. Message them, can I get involved? Or if you want to do, for example, this seminar, I was asked to do this by the people at Medbank, just ask. The worst someone can say is no. And if you don't ask, you won't ever receive. So it's really important to ask. Those are the ways that I'd recommend to network.
I agree with you. This seminar is basically going on. It's what it is right now because we've asked. That's it. As for the third question, someone is asking, what are the most important achievements or tasks that you can put in a portfolio so that it can be better?
Okay, that's a great question. So each specialty, okay, will have different requirements for their portfolio. Some specialties in the UK don't actually require an interview, for example, such as general practice. They just accept you off your examination scores. But the common theme across all these different specialties is having research. Having research and being first author or being involved in research is a great thing to have on your portfolio, and it always ensures points. Okay. other than research, another thing is it's good to have audits as well, which Sana mentioned. That's also a very high yield thing to have. Now, aside from audits and research, is something that I've already touched on, is you want to have examples of where you showed different skills, which is important when you're performing medicine and being a doctor, such as team working, organization, leadership. Those are integral skills as a doctor. And when you're in interviews and they're looking at your portfolio, they're going to ask you one thing. Can you reflect on the things that you've done? And can you reflect on when you've shown these key skills? And the best way to be able to reflect and the best way to get experiences is generally by getting involved in societies and organizing and teaching. In the UK, if you teach for 3 months, longer than 3 months, and organize a teaching series, that also gives you points on your portfolio. Okay, and if you teach, you'll be demonstrating organization, you'll be demonstrating teamwork, you'll be demonstrating great communication. So it'll be also great for you to talk about it within your interview. So those 3-4 different things are really, really important and can really add weight to your portfolio. In addition to that, one thing I did forget to mention in terms of networking was forming good relationships with the doctors that you have on placements. You know, when you begin to undertake, when you begin to go onto clinical settings, you'll begin to start talking to doctors. They've been where you've been. It's really important to strike a good relationship, a good rapport with them. And then through that, that's a great way to network, right? And that's a great way to network. And if you show genuine passion and effort, some doctors may even write you a letter of recommendation, which has happened for some of my friends, and that can also be very beneficial for your portfolio.
Thank you. Thank you. That's quite insightful. As for the fourth question and our last question, this is something that I cannot wrap my mind around, to be honest. It's specializing after the plan in the UK in general. So for us in Egypt, after 7 years of medical school, we then, depending on our GPA, there's so many factors to it, but then we pick a specialty for us. It also depends, as I said, it depends on the GPA. And then you study from 4 to 7 years, depending on your specialty, and then you would take your master's. And after your master's, you are a doctor specialized in that thing. For those 4 to 7 years, you're just a GP.
Okay.
So I wonder how it's like in the UK.
Well, it's a great question which you've asked, but unfortunately, it's very broad in the UK. The pathway for training generally varies from specialty to specialty. Now, you won't do a master's, you'll do a set of exams which allow you to escalate through this pathway, if that makes sense. So, so you have, for example, when you become a consultant, before you become a consultant, you'll have to pass a set of exams in order to become a consultant. But it is quite clear at different specialty programs than I do, as they are quite passionate and they've already made a decision on what to study. So I'd like to open the great question that Omar asked to the colleagues on this call, if anyone wants to walk him through a specialty program, specifically Awais. I know you are very interested in anesthetics. If you want to explain it to Omar.
Yeah. Okay.
Go ahead.
So as Adam mentioned, the sort of the training pathway in the UK, the way it sort of works is after medical school, we have this thing called our foundation year. So that lasts about 2 years. So during those years, we often pick our blocks or rotations as they're known. So within our first and second year, might want to pick, if we have an interest, for example, myself, I have an interest in anesthetics, I want to pick more surgery focused or acute care focused blocks that are rotating. So often when I rotate through those blocks, by the end of your second foundation year, you can then apply for more specialty training posts. So often you would have to sit an exam, which is known as the MSRA. And what that exam entails is there's a practical component to it, and there's also an MCQ component to it as well. And
Glad to thank you guys for arranging basically everything related to this seminar. We could have we couldn't get more grateful to it, honestly. And I just hope, and I'm going to send you some of the feedbacks that are being sent to me right now, and some of which you can see in the chat already. 2 hours ago, all we knew about Leicester was the 2016 Premier League season and Jamie Vardy.
Jamie
Now,
Vardy.
we're significantly happy to have gotten this opportunity. I want to thank Adam again for the seminar or for the conference he mentioned in January. I believe most of us are unaware of it till now, but we will be extremely grateful for it. I want to also take this chance to thank the modulators for this meeting. I want to thank Amara. I want to thank Miriam. I want to thank Yumna, who couldn't but was preparing a lot of good feedbacks and questions as well. And of course, I want to thank Amar when I needed him. He's such a great fellow. And I want to take this one last opportunity to thank also Farah Amin, who was the president of ANSSA, the Alexandria National University Scientific Students Union. They were also part of the attending members for this seminar. I believe it passed 200 at some point, but we couldn't really help most of the other people who were trying to join. Hopefully, it will be a better opportunity for the future. Now I'll pass the word to Farah. If you are here, Farah, you can just open the microphone and start talking, and I will.
Yes. Hi. Hi. Well, as Iyad said, simply I am Farah from ANSA, which is an association that is a member of IFMSA Egypt. I don't know if any of you know about it. But apart from that, I just want to really tell you, I came here, this is for the first time, to collab with a medicine bank, and I am really thankful that they invited us to actually listen to this. I didn't know what to expect, but with the amount of enthusiasm that I see from the speakers and modulators to just make this structured, plus to make it simply, I can tell that you want us to learn. You're not just saying things, you are literally telling us what to do with research or with audits or with the holistic approach. And I do envy a lot that you guys have hikes. Like, we do not have that, but okay. And simply, I do want to thank you. And I want to ask about if we can be attending the internal medicine talk. That would be, again, a very nice thing for us to attend, especially that you guys, like this seminar and the internal conference will be free of charge. That's so nice. That's a very nice thing of everyone to give, simply. And I also have a question here that I wrote down. I'm not sure if Bilal is still here, but he talked about medical essay competitions. And this actually sparked something for me, if we can do something, even if it's on a smaller scale, but if we can do something like this in our own college. Is he here?
Yeah, I'm still here. I think definitely this is something that you could do. Often with societies, they can organize it themselves, but at Leicester we have a mixture of both. So just from recollection, in terms of the student aspect of things, I know that one of the other societies at the med school, the anesthetics society, they did like an abstract competition. And so I think doing something like a essay competition is very doable, and is something that perhaps even us ourselves as a GI society could genuinely consider. With Leicester Medical School, we're really lucky that they publicize some of the essay prizes from from other kind of royal colleges in the UK, and even like our professional medicine regulator known as the GMC. I'm not too sure if the university themselves have a essay competition. I don't know if you guys on the committee have a better idea than me.
We don't right now, and that's something that, like, you sparked the idea into my brain, like why can't we do this, something like this? This is something that the students for sure would like to attend or be part of. So I'm just like, what kind of structure do we put? What kind of prize should there be, like a doctor there to kind of structure this, because we're just students as well, you know?
I think in terms of a title, I think that's something definitely that you guys could think of yourselves or collaborate with a doctor that's willing. You could just propose the idea to a doctor, and if it's something that they have participated in before, they can be in a lot of, they can help you a lot with. Yeah, I think it'd be really useful to get a doctor to perhaps be the one to judge. or you could get some senior medical students to judge. And then in terms of a prize, perhaps you could consider maybe like doing some research, rather with some like revision material, perhaps make sure you make certificates for those that have like enrolled in the competition, and then like a nice certificate for the one that like the winner, the runner-up, and like
Yeah, thank you. That makes sense. I don't think we would be able to do this on our own without a doctor to participate in Dean. So thank you.
No worries.
Yeah, in any case, thank you a lot for the speakers and the modulators again, and for Medicine Bank.
With regards to your essay competitions and such, you should collaborate with so it's all about, in medicine, it's all about innovation, and it's about how we can develop the speciality. So neuroradiology, in the UK, they did a recent one recently regarding climate change. So find a hot topic which is at the forefront of medicine, or just generally global politics, and then that's something that you should make your essay geared towards. And then once again, your faculty members and also doctors, and see with regards to trying to get a publication and just getting an accreditation for your essay, and that will help a lot, inshallah.
Okay, so you're technically just telling me that, like, to find something that is a hot topic and making the essay about it. I'm not sure how the essay itself should be structured, honestly.
So, okay, so for example, neuroradiology was in a world of changing climate, how would you make your subspecialty more greener? So you'd basically, so if it was climate change, and say you were thinking about other areas of medicine, you try and gear it so that making the specialty more greener, and just something along those lines. I don't have any other examples for you, but that's just food for thought.
Yeah, no, thank you. Thank you for sure.
Just to jump in here quickly, I did organise something similar to this within the general practice I work in. So I understand this probably isn't the forum given it's so late, but if you wanted to contact me to discuss how I structured it, I'm more than happy to meet with you privately if you want to do that.
I would, for sure. That would be beneficial. Thank you.
I think my contact details are on the end of the slide, so if you want to email me, then please feel free to do so.
Okay, thank you so much.
I guess that counts it for us today. One final question, because probably most of the attendees would assassinate me if I didn't put this one. So, being in the UK, I had to answer this question, especially after I saw some football club symbols like Manchester United and Arsenal in the final slide. I want to ask this question. Who is your favorite, for all the speakers, who is your favorite, and I'm getting this one a lot, who's your favorite Premier League player in the last season?
Mohamed Salah.
We all right? Obvious.
Bukayo Saka, easily. Bukayo Saka.
Will be amazing and exhilarating meeting for us, and we're looking forward for something in the near future, inshallah, with you.
Thank you so much for having us. It was really, really good. Thank you for reaching out. Yeah. And Bilal said his favorite player was Anthony from the last season. I don't know why, but
thanks, Bilal.
Thank you for having us, man. Very, very kind. Hope everyone enjoyed it.
Thanks.
Cheers. Thank you. Bye.
Thank you very much, guys.
Thank you, guys.
Thank you, everyone.
Thank you so much. Thank you.